And joining us now is Dr. Lippy Roy, internal medicine physician, Dr. James Campbell from the University of Maryland Center for Vaccine Development, and Dr. Sudip Bose, who is an emergency physician at the Medical Center Hospital in Texas, retired U.S. Army major and Iraq war veteran who treated Saddam Hussein while serving in Iraq. So, Dr. Roy, we do watch New York closely because it serves as kind of a warning, right, to other states. But when you have the governor telling people, call this number, we'll pay you top dollar for ventilators and other supplies, how far are we right now from getting ahead of this pandemic?
Chris, it's so nice to be with you. This is just beyond chilling and infuriating. I'm just going to be blunt. We need a public health investment into this problem. People are dying right, left, and center. This virus is not discriminating by age, ethnicity, race. What we need is an investment in terms of understanding the true scope of this problem. We need to identify asymptomatic carriers who we know can infect people. We need to do contact tracing, surveillance to really understand what's going on. But in addition to that, Chris, we also need to be thinking 2-3 steps ahead. We're still talking about PPE justifiably because we have such a shortage, but we need to be thinking about, if we're talking about ventilators and the need for vents, we can only ventilate somebody if we have the medications to ventilate them, specifically sedatives and narcotics or analgesics. As my ICU doctor friends are telling me, look, if I can't sedate them to intubate them, then I can't ventilate them. And if I can't ventilate them, the patients will die. So we really need to be thinking ahead of other things that we're going to be running short of, such as medications.
Dr. Bose, you were in a more traditional war in Iraq. We mentioned that you treated Saddam Hussein. Now you're on the front lines of a pandemic. Are there any comparisons? What are you seeing on the ground where you are?
Definitely, and thanks for having me. I look forward to sharing lessons we're learning in the emergency room from the ER walls here. To answer your question, there are similarities. And, as a practicing emergency physician, as someone involved in the EOC, which is the Emergency Operations Center, which is the war room for our city, the thing we remember is you fight with the army you have, not the army you want. And at this time, we're at war, and you can bet we're doing everything we can do with our supplies, which reminds me of when I was in Iraq with a backpack full of supplies and a team of 4 people, and a bomb would go off and there are dozens and dozens of patients on the ground. So similar analogy. We have an army, it is what it is right now, and we have to do the best we can. So we are coming up with innovative solutions in our city about how to use the ventilators, the tubing, what to tap into for other resources, and setting up systems so we can be maximally prepared. We're in the acceleration phase in the United States right now, so we're gearing up.
But does it blow your mind? Because it certainly blows mine, and it gives me the worst feeling in the pit of my stomach to think that there's an analogy between what you're doing in the richest country in the world with arguably the best medical system in the world, and you're able to compare it to carrying a backpack onto the field of battle with bombs going off.
It's similar, but I think for our listeners out there, there are certain lessons we can take from this. We're in this together. We are the soldiers in this together. We got a backpack. We have what we have. Let's use it. Let's stay safe. And, you mentioned the care of Saddam Hussein, and after he was detained by U.S. forces, I was selected as the U.S. physician to care for him. There are lessons from that our listeners can take as well. I mean, this was a guy who was on the run for months, responsible for the death of thousands of people, and ruled the country into ruin. And providing a medical care, I had to detach from my emotions and actually focus on the mission. So there are a lot of emotions right now. We're dealing with the pandemic. We're seeing the news. Learn to detach and focus on the mission. Remember, the mission for you as a listener is the neural connection from your hand to your face. And what I'm finding in the emergency room is we're having people spread it by a couple of means. Number one is inhaling the particle. It's a 0.1 micron particle that goes through your nose and goes into the lungs and causes acute respiratory distress syndrome, ARDS. You'll hear that a lot. But if we're in isolation, we're keeping our 6 feet, we can protect ourselves from that. And what we're finding in the emergency room is people who have prolonged, meaning someone in the house is sick and you're too cavalier in those initial days of sickness. You're shedding the virus in the first 2 days maximally. That's how it's getting spread, and I'm seeing them in the emergency room. And the second way is the connection from your hand to your face. And, we don't need to be scared of doorbells and doorknobs and elevator buttons. That's okay if we touch those. But if after you touch those, you touch your face, it can go in through your eyes, your nose, your mouth. So that should empower us in this world of doom and gloom. We can be empowered by what we know. And that's what helped me in Iraq. What we know is if we can control touching our face, which is hard to do. I mean, sometimes the mask is more useful to prevent touching your face than it is for the actual particles. So we socially isolate, watch that neural connection, be the hand police, know where your hands are at all times. That's the war we're fighting with.
If you can do what you're doing now, as you did in Iraq, that's the least that we can do. So thank you for that. Dr. Campbell, Dr. Fauci was very clear yesterday that a vaccine is going to be the ultimate game changer. He keeps getting the question, when are we going to be past this? And he said, you have to wait for a vaccine. But in the meantime, we do now have preliminary data from Washington State and from California showing that social distancing works. Help us to understand what we just heard from the doctor, and social distancing can buy us as we wait for the vaccine, and any updates on when one is coming.
Yeah, so thanks. Social distancing or, physical distancing is, if you will, a lay way of non-biomedical way of vaccinating yourself, and that is preventing spread of the disease. So it's both so that if someone else that you might be in contact with, that you would not get infected, or if you're infected and you don't know it, that you wouldn't be able to give it to someone else. So that's what we all need to do, whether we're in the healthcare field or not, is protect ourselves and protect the ones that we love by social distancing. In terms of vaccines, there are a number of vaccines that are in development right now. There are 2 that have already gone into clinical trials, meaning injected into people already. So one study in the United States and one study in China. There are 42 at last count of preclinical, meaning vaccines that are moving along and nearing moving into people, but not quite there yet. We have good experience with moving from not having a vaccine to quickly getting a vaccine to the market from other emergencies, like the H1N1 pandemic flu a number of years ago, and the Ebola vaccine that moved very quickly into clinical trials. So people are trying to shorten those timelines to get the vaccine out more quickly, but they can only be shortened so much because we do need to make sure that they are safe, that they lead to a good immune response, and that they're protective.
And Dr.
Will
Roy,
it be a game
that's
changer, like
obviously
Dr.
something.
Said,
Go ahead, doctor. Sorry.
Oh, sorry. I just wanted to
There's a bit of a delay with the technology.
Yeah. So just to comment on Dr. Fauci's mentioning that vaccines are always game changers. If we can get the vaccine available to the general public and to people who are at high risk, it will certainly be a game changer. What we need to do is, in the past, what's happened is vaccines have moved to a certain distance, like for SARS, the first SARS, for Zika, and for other diseases that then seem to go away. And then the funding for those vaccine programs ended, and we didn't have a vaccine far enough along that we could quickly get it into people. This time, we shouldn't let that happen.
And Dr. Roy, that's long term. That's end of year, next year. You say we need to be thinking ahead more short term. What do you see as the biggest concerns for doctors, for all of us in the coming weeks?
Yeah, so I mean, in addition to the protective equipment, which we've been talking about, not only for the frontline healthcare workers, but we also just need to get some of these PPE to the family members of their sick and unfortunately dying family members so they can be closer to them, maybe touch them and say goodbye. But also the key is other medications. Remember, these are respiratory infections that people are coming in with. We're running low on albuterol and steroid inhalers and antibiotics, in addition to the critical care medications that will enable intubation, such as sedatives and narcotics or analgesics. We need all of these medications to adequately take care of patients.
Dr. Lippi Roy, Dr. James Campbell, Dr. Sudip Bose, thanks to all of you. Much appreciate your time today.